committee should be dealt with by these people who are dealing with these things. I'm very disappointed that we came here on time and we're still waiting to be given access so that we are able to run the committee business. It shouldn't run like this in future. We do not want to be taken for a ride by anything. It is unacceptable to this committee. We woke up very early to do committee business, but to wait for so long is unacceptable. And then you are able to hear what is being said in your own language of preference. Can I see by a show of hands the stakeholder that is here, that are our main stakeholder that we are to talk to? Can you raise your hand if you are not from Department of Health or you are not from legislature? Please raise up your hand. Thank you for coming. Do you have something that you can have interpretations? It is 10 to 11. You haven't been given. This. Is this thing working? I don't know whether it's working. I'll wait for nobody to. Good morning, everybody. Good morning. Let me take this opportunity to welcome everybody into today's stakeholder engagement session. We from the legislature, and I am the chairperson of the Health Portfolio Committee in Gauteng. I am Rebecca Digamela. I'm going to ask those that I'm with to introduce themselves. Over to you, Osi.
Petros Mabunda, member of the Health and Health Portfolio
Good morning. My name is Naomi Inguena. I'm the researcher for the committee.
Good day, Nondomus August, the committee coordinator.
Good morning, I'm Nogazingite. I'm support for the Portfolio Committee on Health.
Morning, my name is Isaac Noah, Service Officer of the committee.
Good morning, my name is Ekina Ninweli, Senior Researcher supporting the committee. Thank you.
Good morning, my name is Wakile. I'm a Senior Information Officer for this committee. Thank you.
Thank you very much. That is the team members that we're working together throughout our programs that we do on behalf of the legislature. Can I ask the leader of government in Gauteng, the representative. I know the MEC is not here. The acting HOD is not here, but there are representatives here who are leading our government. Can they also introduce themselves?
Okay, good morning, honorable members. Good morning, peers, colleagues. I'm Freyo Khongwana. I'm the acting DDG in the hospital services for Gauteng Department of Health. Thank you.
Morning, Chair, Committee, and colleagues. My name is Lisiba Malotana. I'm the Chief Operations Officer of the Department of Health, and I'm a leader of the delegation for today. Thank you.
Good morning, Chair and honorable members, and your support team, colleagues, and delegates. I'm Canada Masanen. I'm the Chief Risk Officer for the Department of Health.
Good morning, colleagues. I'm Petro Lamala. I'm standing in for the CEO for Dr. George Mukari Academic Hospital.
Good morning. I'm Ms. Monene Mugashwa, the CEO of Tshwane District Hospital. Thank you.
Good morning, Chair and Committee, stakeholders, Dr. Matabo Matebula, Steve Biko Academic Hospital CEO.
Good morning, Chair, members, and to all the delegates. My name is Zuleika Remtula. I'm from Gauteng Health Pharmaceutical Services.
Thank you very much. Thank you, and I'm welcoming everyone, all of you, to this meeting. I've been given a list for interpreting channels. Let's start also by welcoming the sign interpretation for us today. We've got on channel 1 is English. Afrikaans is channel 2. Sepedi, Setswana, channel 3. isiZulu, isiNdebele is channel 4, and Chivenda and Xitsonga is channel 5. So you're welcome to use those channels if you want to perhaps get the rest of the information. So I'm welcoming everyone in this meeting. Feel free to participate. There won't be any intimidations, and we are free to use any local language that we feel comfortable with. We will continue to speak in English here, but everyone is free to speak their own language. I am more than welcoming our stakeholder because they are the most important people in our meeting today. The Committee of Health is a representative of the work of the legislature. The role of the committee is to do oversight work on the work of the department. The other role of the committee is lawmaking in legislature. And the other one is cooperative governance, where the committee, through the legislatures, through committees, interact with various stakeholders. Your Public Service Commission, your Human Rights Commission, your municipalities. So those are some of the work that the committee is doing. The other part, which is also important, is public participation. Like what we are doing now is part of the public participation, so that we are working well with our stakeholders. We do not leave our communities behind. If this system was working well, we've got other honorable members of this committee who have connected through Teams. But I'm not sure if they are hearing us, but they connected already from 10 o'clock. So we are a team of about 8 members. But I know Member Bloom is with us in the meeting. I know Member Fuchs is with us. I know Member Masuku, Dr. Masuku also is with us in the meeting. So, but the leadership of the Hansard and the recordings will assist us to allow them to participate. Honorable members on virtual, you are also welcome into this meeting. Let me say, today we are dealing with focus intervention study. This focus intervention study emanated from the budget vote 4 of the Gauteng Department of Health, where the stakeholder is engaged in this session to assist to understand broadly the objective or the opportunities that the business that can come through supply of medicine or equipment. As a committee, through the researcher, that the township economy is having limited or less access to supply in terms of equipment or medicine. I think the stakeholder is here. They will also support that. So it is important for our township economy to benefit from supplying of medicine and equipment. So as a committee, we are opening this door so that we can have an engagement, and the department will respond to some of the issues that are emanating from this vote 4. We see it as an important factor for the township economy to benefit from supplying the Department of Health facilities with equipment such as medicine, such as whatever that the department require. This is a big opportunity that should not be left unattended to. So the committee saw it important that we need to do an investigation of influencing lack of access by township entrepreneurs in supplying medicine and equipment to health facilities in Gauteng. If this can be addressed and be effective, I think as a committee we will also take joy to see that the township economy is uplifted in doing work with the government in Gauteng. So I think you all are having the agenda. Tea and registration is done. Opening remarks I have just done. Purpose I have just done. And we also did the introduction. We now move into item 5. We've wasted a lot of time, that's why we are running, because we don't want to waste managerial time. It's very expensive, I know it. I was a manager, I know. When you miss 1 hour, you've missed the whole time. So we're moving now to item 5, which is presentation by Gauteng Department of Health. Mr. Malotana, as the leadership of the delegation, is going to assist in this presentation. So we will take notes so that as the stakeholder which is with us here today, we are representing you also, but you must also help us so that we also help the department to assist so that the community in Gauteng is also a beneficiary to all what is due to them. So I'm going to hand over to Mr. Malotana Lisiba to take over to you, sir.
Which one? Once again, good morning, Chair, and good morning. Tender the following apologies. The HOD is busy with interviews, and that's why I'll be doing the presentation. And the CFO was delayed, is also on her way here. So I hope by the time I'm done with the presentation, the CFO would be here to deal with the difficult questions that will arise of the presentation. Chair, the senior managers from the department are well represented here, including the acting CEO of the medical supplies table, which is also one of the potential biggest contributors to township economy, given its potential and output. Chair, I would not necessarily waste too much time on the details. Safe to say, Chair, The Department of Health, of course, has quoted 18 billion, just over 18 billion rands worth of goods and services budget, a bulk of which is being spent, and that's what the focus interventions that will have highlighted, that most of our money is spent on commitment, on contractual obligations, and a bulk of those goes to multinationals and not necessarily spent on township economy and local suppliers. And the reasons will be unpacked in details after the presentation in terms of what are the modalities and what are the barriers of entry into the market as far as health space is concerned, Chair. So this, Chair, is just a breakdown of the budget expenditure in terms of where we spend our money for medicines, machinery and equipment, where we are. Maybe what's important is really where the money is spent and what the budget is and where we are currently. This report is as end of the previous quarter. So, and I will not necessarily deal with issues that are not for the purpose of this discussion, but just to highlight the distribution of where the money is spent because of the nature of entry and what are the contributors to the budget, the 5.3 billion that they were talking to. A bulk of it, Chair, as you could see, it goes to training and development, the work in tuberculosis, and of course the HPV, which is actually most of it is a grant money. Chair, as far as the others, and this might be what really interests the stakeholders here, is where other machinery and equipment and how that money is being spent. Of course, we've got grant money that we are using. The bulk of work went into a COVID-19 community outreach program, social development, and of course, I have made reference to HPV. So that's the details in terms of where we are. And what we are projecting the Chair is also to just spend as at end of the previous quarter, as far as those are concerned. Chair, in terms of the challenges that we are faced in terms of dealing with, and I'm not preempting some of these issues, but at a global scale, because we are also expected to report as a department, why are we not succeeding in getting a bulk of this money spent on local entrepreneur? Some of the experience and give a feedback we are getting is, of course, as far as the medical equipment is concerned, the issue is that, of course, a highly regulated industry with the issues about and which is so compounded and worsened by our current litigations as far as the type of equipment that needs to be used, the accreditation requirement, the calibration requirements, and those related issues. So as far as that is concerned, of course, including an example is being used, there is the radiation control certificate if you're going to be utilizing any of the radiation equipment, which is, Chair, one of the biggest cost drivers, just the 4 central hospitals alone, with the type of equipment that they use. That's, if you were to put in monetary terms, that's quite a huge amount of money. Of course, Chair, this is a safe space, and I think we can have frank conversation. One of the biggest issues, of course, is unwillingness of our major big players to partner with local suppliers and of course maintaining status quo, barrier to entry for local suppliers and township-based business to participate. Secondly, the issue about giving the size, the complexity, and the type of technology this equipment gets imported, and most of it has to do with the IP and the lack of the capital outlay that some of the local suppliers might not necessarily always have. Of course, there are some of the government agencies that purport to be able to assist, but as far as we are experienced as a department, there hasn't been much uptake in that area. Of course, there's capacity in terms of skills and knowledge to deal with some of these issues. Same applies, of course, medicines. Medicines are highly regulated and sensitive. If it went, probably everybody as a country will also be producing our own vaccine from every other potential supplier. So the issues of barrier to entry, Chair, remains an issue that government and the committee needs to take forward as part of the discussions. Of course, the regulatory authorities play a factor as far as allowing participation in that, as they are the regulator. Of course, as far as the medicines is concerned, SAPRA, it's being a topical issues, including, and of course, at the beginning of pandemic, we're talking about the local production of Lengana as part of all alternative medicines to COVID, and you would know
the complexities around that issue. So those are some of the issues that we are acutely aware of, and of course the role of the Pharmacy Council as a regulator into the industry. So Chair, what we are trying to raise up front in the presentation is that we are acutely aware of some of the challenges and barriers to entry, and we are then saying maybe a forum like this where government, lawmakers and stakeholders could do is to actually start the conversation and about how do we channel and so start to deal with the resolving some of this barrier to entry issues, Chair. Going forward, Chair, we and I'm happy, Chair, to pause at this juncture and probably have an engagement, because what we are then going to show is from a national RT contracts and what are the current suppliers that are in the field. And Chair, you would know, and I say, and I assume that this is a protected space, that this part of the suppliers that will be reflected here, suppliers that will have to some extent have met the required BE requirement in terms of doing business with government. Having said that as far as how that transform or translate to the actual men and women based that are township based are beneficiaries of that, it's something, Chair, as a department, and I don't have the competency or the skill to verify. But as far as the national contracts are concerned, those are what would fall under the bracket of BE suppliers that we're currently doing business with, that are contracted to transversal contract with the National Department of Health. So I would not necessarily want to engage on each and every. This is just part of the download that we took from the nation as far as we went back and saw who we are really dealing with as far as that is concerned. Chair, maybe without wasting the committee's time, safe to say the issues that we are aware of is that we are, as far as GPG is concerned, we hold the second biggest budget after education. We are cognizant of it, but we sit with the biggest goods and services budget, and we are acutely aware that our money is not following the profile or the economic profile or the citizen profile of the country. And the reasons that we've outlined earlier in the presentation is to say that we are acutely aware probably we need a broader and bigger discussions, including the role of Treasury, DTI, provincial, national Treasury, DTI, and stakeholders in refining and inputting in that. Chair, maybe let me pause there. And Chair, if you allow so that we have a broader discussion, I would also ask that the medical supplies depot CEO maybe just make some comments and input into the presentation so that we can have a broader, detailed, comprehensive discussion after that. Thanks so much, Chair.
Good morning, Chair, and everyone. I think from pharmaceutical services, as mentioned by the COO, I think that the industry is highly regulated as well, and all medicines are usually registered, as well as the limitation is also the fact that all manufacturers, wholesalers, and distributors within that are allowed to handle medicines actually have to be licensed with SAFRA. So I think, and also pharmaceutical services participates in all the transversal contracts that are from National Department of Health. We do not have our own GDOH contracts for medicine. So we do participate in those tenders. There is a very small percentage of medicines which we do buy out, and all suppliers that are actually used are the suppliers that are registered on the central database. We are not allowed to use anyone other than those that are on the central database. So from pharmaceutical services, that is my story. Thank you.
Thank you very much. Department has now given us some of the factors that are affecting the supply by Matresville. I'm just saying the list we see, but our observation through the researcher, the township economy is non-beneficiary of all these things. Thank you very much, sir, and thank you very much, ma'am, for talking honesty here, because you are not allowed, and we want to find out by who, by the law, who made that law. I think we, us here, me and Mr. Honorable Mabunda, to other members that are online, I heard that we will be able to hear them, even if wherever they are. Over to you, Osi.
Thank you, Chair. We must welcome the presentation. At least it has given an indication of who are the beneficiaries of this annual budget of not less than 18 billion per financial year, and how we are spending this money too. And of most important is that most of this money, it's going to, it's fulfilling contractual obligations to multinationals. At least it has given us that much needed information. But if I may ask, or if I understood the presentation correctly, its primary focus was on medicine, whilst the focus of today's discussion, it's on medicine and medical equipment. From how I heard it, the insistence is that you must be registered with SAPRA to supply this medicine. I'm not sure whether does that mean supplying medical equipment, you must also be registered with SAPRA. And I'm just worried because 30% of the 18 billion budget that we are having every financial year, or that we had in the most recent financial year, 30% of it, it's 5.4 billion, which in terms of the legislation, this money, 30% of it should have went to empowerment companies. And from the look of the companies that were presented here, I don't think there's any company that is from Mamelodi, or Tembisa, or Katlehong, or Soweto. Most of these companies are indeed multinationals and predominantly owned outside what one will call the BBB compliant. And maybe the team from the department will also assist in terms of clarifying whether all these companies that are our suppliers, are they compliant with the BBB status, or it will not matter because they are registered with SAPRA. And what also is of concern to me is the two key issues that are raised by the presentation. One is that it is a highly regulated industry, and most of the township entrepreneurs, they lack skills and capital outlay. And it's a very unfortunate statement, because I can in turn ask it to assist township entrepreneurs to be compliant to what SAPRA is looking for, considering that it's a highly regulated industry. Because I don't think these suppliers are born suppliers. They got assisted somehow, somewhere. And it's unfortunate that we will be saying to the people that you lack skills and capital outlay. And if you look in terms of the representative of some of these companies that are listed as suppliers here, you find historically disadvantaged individuals as the contact people for those multinational companies. And that's an indication that skills, it's out there. But when we are supposed to be empowering those that have been left outside the economical stream of this country, we start raising this issue of skills and capital outlay as the presentation will have wanted us to believe. And I think it's an indictment to the department and all of us to continue in this way 20, 25 years after people have expected that things will change. And there is no indication that things will, in the near future, change if one looks into what the presentation is saying. I think, indeed, Malotana, we must have a discussion that will seek to resolve this contradiction that is currently availing itself. It's not something that we can now and in the future continue to allow it to exist. I think for now, Chair, I will pause there. Thanks.
Going to ask honorable members who are on teams to come in and make some comments. Honorable Bloom, do you have anything to say, sir? I know we have Honorable Bloom, we have Honorable Fuchs and Honorable Masuku on teams. So we're still waiting for our support staff to let them be on the platform. The mics are not unmuting. Yo. Honorable Fuchs. Please unmute your mic to speak. Please unmute your mic. Please unmute your mic. Please unmute your mic. Please unmute your mic. Unmute your mic. Unmute your mic. Unmute your mic.
Whenever somebody says keeps on repeating itself, but anyway, yes, you can hear me, right? But anyway, you can hear us.
Yes, Member Fuchs. Yes, I can hear you.
Hello?
Yes.
Chair?
Yes, sir. You can speak. Member Fuchs?
Chair, can you hear me?
Yes, very well. But he doesn't hear me.
Chair?
Phone him to speak, we hear him. Yes, Member Fuchs, you can speak, we hear you. Phone him to tell him to speak.
Hello, folks. I hope we can hear you. Can I continue, Chair?
Yes, Honorable Fuchs, continue.
Hello?
I asked someone to call him to speak.
Sorry, Chair, I can't hear you, Chair. Thank you. I will continue. But I can't hear what you're saying, Chair. I want to
Can you please, at the table, don't increase volume, let him just talk.
What has the department, in fact the government, done in the last 25 years to ensure that people are in a position to take advantage of opportunities that exist out there? Now, we heard that when we talk about, medical equipment and pharmaceuticals, that we're talking about very high-tech equipment that not anybody can deal with. We're talking about many regulations and licensing requirements when we deal with pharmaceuticals. So that does create a high barrier of entry. And it's really disconcerting to raise people's expectations in the hope that they could take advantage of opportunities, only to be told that they do not have the resources, they do not have the wherewithal, the regulations do not allow them to take advantage of such things. And so, it's not nice to have your expectations raised only to be smashed because of all those particular matters. So really what is required in my view is work to be done by the department in evaluating all those opportunities that may be available to township entrepreneurs, and then coming back at some point in future with something tangible.
Table, what have you done there now? Done there. Can someone call, can Tembi call Member Bloom or Member Masuku to speak?
That noise, he was on a phone call and a Teams call at the same time.
Oh.
That's why we're getting worried.
I'm back.
Yes.
I've been kicked off. So, Chair, already ordered the department to go away, to crystallize this whole presentation so that we can come back and present to the community those opportunities that are really available. Not pie in the sky, not stuff that people cannot do because of regulation.
Can we welcome Member Bloom? Just shoot, sir, if you are there. Can I welcome Member Masuku? Okay, thank you very much. I think we're not going to wait for them because we're not sure if they are still with us.
Still with us.
Member Bloom says he doesn't have any question.
Okay. Yeah, so thank you for inputs from, we've got 18 billion that is spent on this medicine and equipment on annual basis in our province. I think it's up to us now to go and look at the policy as to where are the policy shortfalls that are dealing with our people. The red tapes that are there, highly regulated and licenses that are preventing township economy to benefit the 30% that is put on annual basis. I think it is not wrong for the committee to have identified a gap and address it. And I think we shouldn't be worried. We are not encouraging people to come with big ambitions. People will start somewhere, but they have to benefit from what is due to the people. I'm now going to move because we cannot continuously wait for honorable members that are being cut off by the system, which is very expensive, that we brought here so that they can be participants here. But unfortunately, the system is also giving us problems. I think us as a committee, we will also do our bit to assist where possible. We've done well. I think we congratulate ourselves for bringing it out, and the department is showing us. So it's up to us who are representative of the people to go and assist in any way we can. We are not blaming the department. We are just highlighting where there is a gap that needs to be addressed. Now I'm opening the platform for the stakeholder that is present here to also take part in this discussion to assist as to how can we move forward with this that we have brought out, that the township entrepreneurs are non-beneficiaries of this. So, yeah, can I see by raise of hands those of our stakeholder who would like to participate in this discussion? I'm just going to give you numbers so that then I know. So remember, I said we've got interpretation there. You must not be worried. Those who are coming in, there are chairs here, please. There are chairs here. You're welcome to sit here. You can stand up on your feet. Those who would like to say something on this topic. One, behind Dr. Majila is number one. Number two, you are number two. Sit, just sit. Number two. Number three, I thought you are an official. Okay, sorry. So you are number three. 4, 5. I've got 5 hands. Those who joined us now, I hope you are the stakeholder. 6. You are stakeholder, you are not officials, ne? Yeah, here we are talking about we were trying to get the factors that influences lack of access by, you must please give them the earphones because we are allowed to speak any other language here. So we are not forced to speak only English so that everybody can express them their preferred language. So renamo re bolela ka dikgoreletso for township entrepreneurs in supplying medicine and medical equipment in our health facilities across the province, and yet a percentage on annual basis is given that this should be benefiting township economy or entrepreneurs from the township, but it is happening. We're not sure, Mara. It's like it's not happening. So we received a presentation that some money is given. So maybe when those who have raised their hands are speaking, you will be able to hear what was the presentation all about. But there was a mention of high red tapes for access, sophisticated equipments that a township person may not be able to provide, and then other stuff from that company somewhere in Pretoria that does have to allow people to provide or not provide. Can I take number one?
Okay. Check. Okay, thank you. I don't know whether I'm audible enough.
Yes, you're
okay.
audible.
All right. Thank you, Chairperson, and the committee as well. You know, and for the presentation that you have given to us. You know, it is very much fascinating and very much interesting. So we appreciate for that kind of information. So I don't want to go back to the kind of challenges that you have spoken about in terms of the barriers for the township entrepreneurs to get into this industry as well. So, but I've got some few, okay, actually 3 suggestions that I'm going to put forward here as part of my contribution. So I am actually, I forgot to even introduce myself. So I'm just an ordinary citizen from Mamelodi. So, so my suggestion is that since we know about the barriers and the research has been done, you know, sufficiently so. So I've got this following suggestion that if we want to see the township entrepreneurs, you know, to participate in this township economy, I think number one is that we need to, you know, as the department needs to conduct a workshop or workshops in these different townships. You know, we need to go to the places where the people are. We need to go to Mamelodi, we need to go to Outrageville, we need to go to Soweto, we need to go to where the people are, because people are not actually aware as to what is really happening in this department in terms of this be actually benefiting from. So now we need to go into these townships and then be able to make the workshops and be able to educate our people to, you know, to know the kind of requirements that are needed for people to be able to participate in this industry. So, and then number 2, I think that we need to also review if there is no policy or a law at all, that we need to make a law or a policy that compels those who have been participating or who have been benefiting from this industry to either employ the people from the townships or to make partnerships with the people from the townships, so that they can be able to get an experience and exposure of this industry of supplying the medicine and the equipment as well. So I think in that case it will be easier for the people in the townships to be able to participate in this industry. And then number 3, as
as my suggestion, I want to make a suggestion as well that we need to also make a set aside funds strictly channeled for or to the township entrepreneurs in order to encourage them to participate in this particular industry. Thank you.
Thank you. Number 2 is here in front.
Naomi Inguena. I'm a business developer at Triple N Medical. I'm a nurse by profession. I left nursing in 1998 and I started business, Best Care Medical Supplies, which the business in the first 10 years, it was doing pretty well. It had employed people, about 25. It had an office in Cape Town. We were beneficiaries mainly of Gauteng province. We were supplying nationally all the medical goods, I was representing a company called 3M, and I worked as well with Johnson & Johnson. And in those years, the government was very strict in empowering black people and black women. And there was a strict and a transparent BEE compliant processes that were followed, which the companies were also respecting. So they were empowered last 10 years. Now I'm talking about 2009 up to where we are. We will participate. I mean, the barriers that the government is talking about, yes, it is true they are there, but they are also educated people who can follow through the processes, who understands and be compliant. A lot of businesses, I will talk on behalf of small businesses, a lot of them, they are compliant in Gauteng. They are professionals, they've worked with multinationals, they've got experience, they know what they are doing. They sell these equipments, those that are in capital equipment, those that are in disposables, they know what they are talking about. But the barrier is with the departments and the hospitals now, when it has to empower people. First it was GSSC, it was tender board. That's when I started with board Dr. Danisa Valoy. And then it went to GSSC. Things were a bit better. And then it went to medical depot. Things were better because they were buying in bulk and the hospitals were ordering from the medical depot. So everyone would have a piece of cake there. But when the process was transferred to hospitals, that the hospitals must procure these services directly, that's where the problem started. Because now there, you'll find out that if you don't know anyone in a hospital, you don't get business. No matter how compliant you are, and you are paying these subscription fees with SAPRA, you pay a yearly annual fee of 4,000, registration is 13,000, but you can hardly make that 13,000 in a full year, which is a big problem to us, and we don't know how to manage that. Hospitals, no matter how you go and complain to CEOs to do what, they will call a meeting, they will bring the procurement people, but it's just the same. So I don't know where the problem is and what is going on. And the communication with the department, it used to be there. You'll used to go and set up an appointment and say, these are my challenges, this is what is happening. And those people, they used to make sure that they really listen to you and try and do something. But now nobody wants even to take your call. If you are lucky to get a business, to get paid, it's a mission. You have to fight and fight. Once you do that fight, you will never see any quotation sent to you again. So we are facing a big challenge as entrepreneurs, Not necessarily that the skills are not there, not necessarily that we don't know what we are doing. We are blocked by who? We don't know. Why? We don't know. My business was liquidated. It was making 17 million per annum. It was liquidated because the department was not paying. I lost my houses and I was alone now there. And those are the days when we will be given letters to say, oh, we'll pay you so much, the run will be on this date, and come that date, the run is not there. And you are working with banks, you have taken money from the banks. Now the banks, they want their money, you can't get to pay them, the department can't pay you. So we have gone from a bigger ambition of what we wanted to achieve to nothing. It's discouraging. I'm talking on behalf of everyone that I know who runs a business as a black person, whether male or female. There are many. I will give the committee the list if you allow me to do that, so that you can talk to those businesses and hear what their challenges are. So I'm disappointed because even right now with the PPEs, at least we tried to get some business at Gauteng, a bit, but the government regulations also are a stumbling block to growth because they say local manufactured goods, they are encouraging local manufacturers locally, and how many are they? It's very few. We can't all, as a lot of thousands of business, go and source products to 1 or 3 manufacturers. It's impossible. And now, I'll talk about the recent RT contract, which they advertised, RT 42 for Treasury. They are specifically saying, if you don't comply with local manufacturing products, you are out. Don't even attempt to tender. But how many businesses are there that are going to go to, there's one in Cape Town. That's the only one that we know. We can't all go there and source products from that manufacturer. So as a result, the government's compliance requirements, they kick you out before you even make any attempt. But as before, we will import stuff and compete, though we will be out of the market because there's a lot of transportations and taxes and everything else that is paid when you bring in goods from overseas. So it is a challenge for small businesses, and DTI, when it has to give those letters to exempt you to source products out, they don't do that. They will just give you a list of companies that we have companies that are making these products local. When you contact those companies, they say, no, we are going direct. So you can see that the business is still white, male dominated, especially in health. So there's no way that we can venture into this business or anybody else, or even if they want to procure from us, our prices are high. Then they go back to the multinationals. Because we are talking the same language, we are saying the apartheid has damaged a lot of things and we are trying to redress. Now, we as businesses, we are competing with companies that have been there over 100 years. And we are supposed to compete with them. How do we do that? How do we achieve that? We cannot. You can't ask a person that is 1 month old to have the same prices as a company that is supplying the whole of South Africa, private and national. It is impossible. So there's a lot of work that the government has to relook into how their policy will be able to empower black businesses. Because even the CEOs of hospitals are here. They will look at, we are also audited. Why did we buy this thing for so much instead of buying it for so much? Then who has got the lower price? It's a multinational. And where are you? You start with ambitions, you walk until your shoes are finished. You can't get anything. So I really like this topic and I want to be part of engaging and see that we get progress in how we can get to empower black people in this country, because there's a lot of challenges. SAPRA, they take forever. There are companies that have submitted their licenses 2 years ago that I know they still don't have a license before COVID. And now they are stuck, they can't do businesses. So it's all these regulations that are hindering success for people, and that's where we are with high unemployment. Because if you look at the people that I had employed,
and the red tapes that are there and the neoliberal kind or colonized kind of policies. Number 3.
Good morning or afternoon. Is it on? Okay. So my name is Nelly from Triple N Medical. We work together. I'm not going to say much because she's addressed most of the challenges that we have. But what I did want to add was that because we've got all these years of experience in terms of also venturing into the township economy, there are businesses like us that can be used to help mentor and assist the small businesses in the townships. But if it's a whole partnership where we're working from government, Gauteng Health, all the way to the township economy, so that they're also able to deliver. Even though they get the business, there's certain business processes that they need to be aware of, distribution, making sure your orders, your invoicing, and all of those things. And these are things we've learned with experience. So if we can partner township businesses with experienced businesses like us, then they stand a better chance.
Thank you. Number 4.
Good day, everyone. My name is Untitled Chapter. I'm a pharmacist by profession, and I've actually worked in industry for many years. I've done regulatory, quality assurance, and I've done retail. The topic that's being discussed today is a very interesting one, and it's closer to home, because I've recently branched to business. I've opened a business with an aim of actually focusing on the, excuse me, of using my experience and supplying product to all sectors, be it to business or private companies. So the challenges that have been raised are the challenges that are very much known to me. And in addition to that, the policies in South Africa, especially maybe if I can just say the tendering process, is where most of the problems emanate from, especially when you are starting. The lady here has spoken about the challenges from a perspective of someone who's already started. And the challenges from a perspective of someone who is starting now are even bigger, I tell you that. Because just when you're planning on tendering, you don't qualify. Just by reading the tender, all the requirements, the only qualification that I have on a tender is triple BE, because I'm a black woman. And when it comes to experience, I have the experience from corporate, which I have. However, my company does not have an experience. So if I'm trying to apply for whatever tender that's there, I will already fail, because I don't even have any proof that, okay, my company has done such and such. As much as I have all the experience that's required, and even my team would have that experience, but as a company, I don't have that experience. So it's like you fail before you even begin. I think we need to re-look into those requirements, because it still favors the big corporates, the multinationals, who have been doing this for years. They're the ones who have all the experience, and then they end up getting those tenders. And so basically, I'm actually adding on to what she already said, because that's the truth. Those are the issues that are affecting everyone. And I know that someone actually touched on experience, saying that maybe township entrepreneurs do not have experience. That is not necessarily true, because if you can look at all these multinationals in corporate, who is actually working in those companies, it is mainly us black people who are actually working in those companies. So we have the experience, we have the education. However, when it comes to going to the ground, you know, trying to make a living for ourselves, then we just fail before we even begin. And the other thing is, I'm just going to tackle the issue of the regulations in this industry. It is a highly regulated industry, and it actually does make sense because we are providing medication and equipment that actually touches people's lives. However, we need help as Black entrepreneurs. For those of us who want to comply, if you want to be compliant, you register a company, you apply for a license. Application for a license is very expensive. There was a group of us a few years ago. My colleagues and I were trying to start to register a pharmaceutical company. And the amount of money that's required and the amount of skill and the amount of time, we had to have full-time employment because obviously we couldn't just not be earning. However, in order for us to succeed, we needed to actually let go of our employment. Or at least we needed for at least to be one person who actually lets go of employment and takes care of things and runs things. And obviously we were not able to do that because we did not have the funding. So funding becomes a very important stumbling block for any Black person in South Africa who's trying to open a business. I'm working that path even now. I'm looking for funding to open a pharmacy, something as small as a pharmacy. Funding is a big issue. You apply, you submit the applications, but also it's like you have to jump through hoops in order to make it. It's like the requirements are just too much for a normal person for an ordinary person to actually to be compliant. So the only way that you can actually make it is if you come from a well-off family and you happen to have money or you know someone who has money. But all these funds that we are promised, and it's actually very sad because we are promised every day that, okay, there's funding, you know, the government institutions can offer you funding. I'm applying now for funding and it's becoming a nightmare. It's like my dreams are getting dashed right in front of me, in front of my own eyes. So I think we need to go back to the drawing board as government. It is very important if we are to see South Africa becoming the country that we want it to be. We need to have people in government who actually care. People who are going to pick up the phone when I phone to inquire about a specific requirement. People who are going to answer emails. You send an email, it's as if you're dropping an email to a bottomless pit and you'll never hear anyone answering. You phone the numbers, some numbers are not working, some numbers do not get answered. It's heartbreaking being on this side of things. It is very difficult, and things will remain the same, especially now. I mean, we are going through a pandemic which has actually wreaked havoc to almost everyone. So perhaps maybe if I can put it this way, I'm pleading with the government to just try and go back to the drawing board and change the way things are being done. There's a lot of other things which I can't even say now, but we need our government to start supporting us as they say they are supporting us.
Hello,
it is just very difficult.
Can I ask you to not withhold those things, because as a committee, we need to hear everything. If possible, you can also write those things that you say you cannot say. Because we, as I spoke earlier, I said we also have cooperative governance is part of our role. We've got our sister departments or other entities of government where we also can share the information to get assistance. We've got, for example, Public Service Commission is one other area where we can be representative of yourselves. So if you can't speak, you can write things and give them to us here. Committee coordinators are here.
I suppose then I can be able to use other channels of communicating. But I mean, for purposes of this meeting, I don't want to end up taking the whole day just, talking. But in a nutshell, what I'm actually, my complaints are that we don't get funding. We hear every day that there's funding, but when you try to tap into it, when you try to benefit, it becomes impossible to get funding. And the regulations are there. The regulations, again, require funding. You need to be able to have money. The licenses, the amount of money that you spend on licensing alone before you can even start investing in your business can be very, that can be discouraging. It's a lot of money. It's substantial money when you're actually trying to start a business and you're not earning from anywhere else. And then thirdly, the policies that are actually there in place. We need to go back to the drawing board and just look into how those policies are structured, especially talking to specifically the tendering process. The tendering process is just, it's favoring those who have been there already currently. If you're new and you're trying to get into the game, it kicks you out before you even start. So those are the 4 points which I've actually identified as being the barriers for us.
Thank you very much. Number 5. Otherwise, if you are covered by the previous speakers, you can also say that what was not mentioned. Thank you.
Yes. Good morning, everyone. Thank you very much for this meeting. I think we were all anticipating and wanting to have something like this. My name is Naomi Inguena. I come all the way from Vanderbijl Park. So I'm an entrepreneur. I've been running my own businesses now for about 15 years. I started as an engineering consultant. I have a postgraduate diploma in public health, specializing in HIV and AIDS. I am currently also running my own business as a medical waste transporter. So if you're looking for people and entrepreneurs that are hungry and wanting to really, contribute to society, as well as also, I live in the township. I'm from Vanderbijl Park. I live very close to Sharpeville. So we're here. Entrepreneurs are here. We're hustling. My sister, it's a hustle. And it's one that I think as entrepreneurs, we know how hard it is, but we don't give up. And I'd just like to say that, yes, I have been covered, but there was just a couple of things that I like the gentleman, he's not here right now, and he was giving solutions. And I think right now we need to also look at that. We need to look at what can we do. And some of the things I know as a committee involve a lot of law and stuff like that. And I think that's where we need to start. We need to start just like the BEE Act, just as it came in and tried to relax, all these barriers, all these things that we as disadvantaged people have had and are still experiencing. I think that the government really needs to look at those policies and see where they can be relaxed and see where opportunities for black SMMEs, how we can have access. And it starts as simple as the gentleman was saying, either we're doing workshops for people that are interested and are in the business and want to, and see this as something that they can live off, because we are here. I mean, I'm surprised that, this room is not full, because I know that there are entrepreneurs out there that are in the medical field or that want to be part of this. So we are here. I just think that government just needs to lend a helping hand. In terms of what the cake is like, because there is a big cake for all of us. I think that, we just need to start small. We need to start with entrepreneurs in the townships. We either need to empower them with skills and training, and then we need to just help them to go and get those licenses and registrations that are there, because yes, the fact that it is a highly regulated field is not a barrier. I don't see that as a barrier as an entrepreneur, because I think as entrepreneurs, we see ways of breaking those barriers. Whether it be I need to now get educated about what I'm doing, I'll do that. So for me, the regulation is really not a barrier. It's one that I'm like, okay, it's a challenge, but somebody can teach me how to get through. I think it was Mr. Mabunda who said that nobody woke up and knew what this thing is. Nobody woke up and suddenly just knew how distribution is or what is licensing. Somebody had to help them, or somebody had to teach them of these things. So I think that's the view we need, because I don't think that there is a lack of entrepreneurship. I don't think that there is a lack of people out there that want to go into this. And so I think this is a good step from the portfolio committee. For me, this is the first time I'm attending something like this, and I think it is a great step. But I would really wish that, you know, it moves from here to something that there can be a plan. If the committee can say, this is the plan, we've identified all the barriers, we've identified these entrepreneurs, or we've identified these sections where the need is. And so the plan is that, first of all, either we relax the policies, or, you know, we start to look at what can we do to encourage the township entrepreneurs to come, by skills, workshops, whatever. But I think we need a plan going forward as well, so that we can also be encouraged to contribute to the economy. Thank you.
Thank you very much for those inputs. Can I get number 6? Number 6.
Okay. Good day. I hope you don't mind me sitting. Good day. My name is Lebo Mohoji. I'm an entrepreneur, and I'm also in the health industry. I'm going to talk about my experiences, mostly because I've been participating in some of the transversal contracts. I think for me, first and foremost, the most important thing is also the attitude we get with the government employees. I think if they can be proactive, and I mean, they get their salaries, they should also think about us, that we need to pay salaries to the people that we employ. They say there's a 30 days payment policy, but you find that you have to run around after them way after 30 days has elapsed. And once you do that, then you won't get any work from them, even if you are participating in a contract where you're supposed to be even given POs. And then I think one other thing as well that I've also realized in this industry, and also in the procurement processes, is that most of the tenders, they were it was multinationals or white people who were participating mostly in them, and as a result, they become so comfortable in them that year in, year out, they get the tenders. And when you come as an entrepreneur who's black from the township, they will create a barrier for you not to get in. Either the suppliers that are supplying us, they will refuse to partner with you so that you can get experience through them. And then the other thing that is also big for entrepreneurs is access to funding. You go and apply for funding, but the departments don't talk to each other. They don't work together in terms of funding. You find that you apply, and then some of the organizations will say, we need a session, we need to sign a session agreement. So take this form and get it go signed by the department that you are supplying. When you get there, they say, no, this is not how we work, we're not going to sign that. Then you end up having either a contract that you're not able to get funding for. And when you do get funding, then it takes time. You end up paying more interest in terms of the monies that were loaned to you, and end up making a loss. So As a result, either your business will get liquidated, or you won't be able to pay your employees because you'll be making losses, because no one cares whether you get paid or you don't get paid in the department. Yeah, thank you so much.
Thank you very much for those inputs. Say upfront, the Public Service Commission is able to help those who are not getting paid on time. We also had a meeting on the side of Finance Committee last week, or is it early this week? Yes. And we received a presentation from Public Service Commission because where payments are held without releasing them, that committee is able to assist. It is also one of our sister committee that is helping for departments that are not complying to the 30 days payment. So they will also be able to help. I have learned that we are on YouTube and Facebook. I will wait for a few minutes to check if there are any people on Facebook or YouTube who would like to raise some questions. And on the issue of few people in the meeting, we still comply with only 50 people in an open space like this. So we couldn't get a large number of people, then we will be non-compliant, and we are a health committee. So I'm repeating, the Public Service Commissioner was also on Power FM yesterday. They were talking about these issues of 30-day payment, where departments, including our own department, are not compliant with 30 days payment, and it is classified, I think it is malpractice. And I think we are hearing you that there is a serious exclusion criteria for the township economy by the system because of rules that are put there which are difficult to bypass. However, we may not even exclude problematic employees that also are not doing maybe their job. But the CEOs are here. I think when they leave here, Dr. Matebula, you need to go and check what's going on there. We're not putting you under any pressure, Dr. Majila, but we expect you to go and check if your system is doing justice, because I think the second presenter spoke about the problems that came after decentralization to hospital facilities. Before decentralization, I think the system was user-friendly for the township economy. I think they are also mentioning the period from 2009 onwards, where a lot of challenges were experienced by those who were trying on their own to ensure that the system is beneficial to them. So in other areas, I think the committee is busy compiling notes here. So we're going to prepare our own report, and we will be able to submit. And we are getting information. We received it from the presentation, and yourselves, as our important stakeholder, you are also informing us that the multinational companies that have been beneficiaries continues to be beneficiaries. Hence, I'm saying there is an exclusion criteria at where the neoliberal policies are continuously being used. So we also, as a committee, are having a homework to go and do policy review. And I said we are also lawmakers here, so it's up to us to also assist if we go and prepare a report and come up with a way forward. We have had you with a lot of issues that you have raised. There is no skills transfer. Funding remain a serious problem, which I think it shouldn't be the case. The SAPRA, I think we've got national, where we can see how, if we were to come up with a policy review as a province, we're not working alone, we're reporting somewhere. So the legislature is empowered to come up with policy review or policy lawmaking to ensure that certain issues are addressed, because nowadays there is no more a job that you will get straight. You need to come up with ideas, but when ideas are coming up, they should not be shut down. Wakile, do we have any questions on Facebook? Okay, no, we don't have any questions on Facebook. I'm going to give Honorable Mabunda can share something, then we will welcome the department to come and give some responses under the leadership of Mr. Lisiba Malotana. Hosi?
No, thanks, Chair. I think I take note of all what is raised by the stakeholders. And I think it will then up to us and the department to see how we resolve some of these things. There is in Gauteng at the moment the township economy bill that it's in the process of being made an act of the legislature, which within it there's this SME fund that seek to provide wholesale blended finance that can do risk taking. I think I will encourage everyone to just follow the process and the conclusion of that bill, because as soon as that bill is concluded, that fund will be set up. And I take note of the challenges that sometimes entrepreneurs get to confront when they apply this funding from these funding agencies that government established in order to assist, and wherein those that are responsible to do it don't do it as they are supposed to do it. But that's why the chair is talking of the Public Service Commission, which needs to also come on board to assist those that are doing malpractices within the public service, and that is giving government a bad name. But also, I think the department will indicate how they are going to assist or formulate plans and strategies to support the development of entrepreneurs. Because in any way, Chapter 2 of the Township Bill compels government to formulate such plans and strategies to support township-based entrepreneurs, and also build capacity programs that will seek to assist the township entrepreneurs. And I think one of the stakeholders did indicate that there is a need to conduct awareness workshops about all what we've been talking about and what the government is able to provide, and how entrepreneurs can be assisted to further develop their business. But of challenge as well, it's what is alleged that in hospitals there seem to be a concerted effort to sideline those that seek to raise small issues. If you demand payment of the invoice that you've submitted, you get to be victimized by no longer receiving these PO orders that you are supposed to be receiving, which ultimately will have an impact on you as a business entrepreneur. I think it's something that the CEOs must take back to their procurement section to correct it, but also to make sure that this 30-day payment period, it's not a paper exercise. It's something that must happen in hospitals. It can't be that when people are demanding to be paid for the services that they've rendered, it must look like we do them a favor by effecting the payment. I think it's something that the department and the CEOs need to find a mechanism, Chair, to resolve that thing, because it's not for the first time that we hear about this. It's very unfortunate what is happening in hospitals. And to an extent, to what the stakeholder has said, that when this thing was still centralized, things seemed to have worked better. But now, because it is in hospitals, there seems to be an abuse of this process in hospitals. But it's an allegation. Hospitals need to look into correcting such so that we continue to provide service as we are supposed to. But ourselves as the committee, we need a mechanism of making sure that we oversight that the supply chain provision in hospital, Chair, because these allegations can never go unchallenged, whether true or not, but it's something that we need to look into out of these sessions. But otherwise, I thank all the contributions that have been made. Thank you, Chair.
Thank you very much, Honorable Mabunda. Can I welcome Honorable Masuku? Doc, you're welcome.
and particularly government, is to make sure that those businesses, they do get funding, you know, and there are new ways, innovative ways where people, their purchase orders, and these are issues that we need to look at, procurement processes, the fairness, the transparency, and the second part is the support for those who are competent, and the third part is just to also change our mindset in terms of the narrative that we want to give. Because the narrative that is out there is perpetuated by us that all black businesses and that's a negative narrative which in a political sense could be discouraged, that not all people are corrupt. Thank you.
Thank you very much, Honorable Member Masuku. I think we managed to recover our time. I'm going to welcome Department of Health under the leadership of Mr. Malotana to give some responses to issues raised by our stakeholder. You are welcome, Mr. Malotana. Thank you.
Thanks, Chair, and thanks to the committee and the stakeholders for welcomed inputs. Chair, as I said in the beginning, the CFO was on the way. The CFO has since arrived. She was part of the listening session of the feedback. So for the sake of time, I will just try and summarize some of the issues, and then I'll ask the CFO and other managers to input where is necessary. But safe to say, Chair, I think one is maybe where Member Masuku left it is that I think there's a concession on our part that more can be done as far as government departments and the integration. And I'm raising this issue because there is an issue that Member Fuchs raised about what has government done. And government has, and I'll give an example of something that I'm quite familiar with in terms of supply development program that the Department of Economic Development has done successfully so, especially in two areas, and I'll talk to one, that barriers to entry in terms of the DTI requirements for linen suppliers as being the most absolute for issues about local content. Suppliers were referred for supplier development with economic development. 5 million was put for cooperatives and women-owned businesses to do that, and successfully about 21 women cooperatives have successfully completed that program, and they're able to directly contract and do work with the department in the provision of linen, as an example of where government puts ideas together, it can work. And I think, Chair, as the issues that are on the cards today, those are examples of what government can do better in terms of supply development. One of the biggest consumption of Department of Health budget, as an example, is healthcare waste management. And one of the stakeholder makes reference to that issue. The barriers to entry in that space, one, it remains ill-transformed purely because of barriers to entry. The question should be, how does government, looking at its own legislation, ensure that there are mandatory rules that it requires and forces partnerships so that that space can transform and move from 4 suppliers that are mostly males, and then improve access. So, Chair, without dealing with the specifics, I think the concession that government should refine and reorganize itself better, it's something that we need to do. Chair, with an understanding that maybe the committee can assist in terms of bringing all these other department agencies in their role to then say, if health is spending so much money on this area of work, how, from the funding point of view, from regulatory point of view, from compliance, how do you assist? Because, Chair, the wisdom comes from the end user and the collective that is in this room. But those that can assist in changing the transforming the business environment are not in the room. My suggestion would be that DTI, Treasury, the funding agencies be part of the conversation in future, so that we have everybody in the room, so that if somebody has a business at health that requires supplementary funding, that person should not be moving between government departments. In fact, once they've got that within the government system, because it's secular, should be able to do that until that completion. So, Chair, those are some of the issues that comes out of this issue, and I'm the first one to concede that. I think one is we also need to articulate what are these opportunities, like the example I gave about supply development, but there are a million other examples I know in the space of vegetables for agro processing and others. So how do we bring all those things? And for the purpose of today, how do we, with this high barrier to entry, including the engagement with SAPRA, and what are the issues? So those are the issues that I felt I should just maybe reply on them. But the greatest for me wisdom was the colleague from, participant from Mamelodi, about how do we then deal with creating understanding the issues about those workshops that were referred to, and of course the articulation issues about ring-fencing some of the funding in the budget, and how do we as a portfolio committee, as in a legislature, enforce those things to come into be. But I think, Chair, maybe let me leave it here with an understanding that we concede and we take note some of these issues, and then ask if my colleagues have got one or two things to add, maybe starting with the CFO and the CEOs that are in the room. Thanks, Chair. Maybe let me pause there.
Thank you very much, Mr. Malotana. Can I welcome the CEO? You are welcome. I mean the CFO. You're welcome, ma'am.
Good afternoon, everyone, Chairperson, members of the committee, the public at large. My name is Lerato. I'm Lerato Maggio. I've just recently joined the department. I think I have 4 months being in the system. So many of these things are still new to me, and I obviously note the challenges that we're facing, specifically as Black women and youth-owned companies. Health is not an easy department to manage. There's quite a lot of bureaucratic systems that are controlling supply chain. And of course, we are looking into how then do we break all these barriers and assist our Black-owned firms to actually get opportunities in terms of business. Let me first appreciate the comments that were made by the first 3 ladies who spoke in terms of, them having experience and the know-how in terms of capacitating youth-owned and Black-owned companies. I think it's something that we would want to welcome and maybe discuss in detail as to how then we can empower our youth-owned companies. Maybe just to give a high-level report on performance of the department in terms of preferential procurement. We have had a budget of about 3.5 billion that we had structured this financial year just to make provision to Black-owned firms. Of course, there are challenges that we are seeing in terms of the quality of competitive documents that are coming through. And it's simple things that, our own Black companies are making mistakes onto. Issues of tax compliance, for an example, issues of accurately and attaching SBD forms. Those are some of the challenges that we know. You know, it's those little things that actually disqualify our own small and medium enterprises. And we have had a situation where we cancelled some of the tenders just on the basis of some majority, let me say 95% of the companies disqualifying, and rather opting to re-advertise and have the specifications reviewed to make them simpler in order to allow a bigger scope of people coming on board. As I was saying, the stats that we had reported for the first quarter of the current financial year in terms of preferential procurement, we as health, out of the 3.5 billion budget allocation, we could only, and remember 3.5 is for the whole year that we are planning to spend on black-owned companies. We had plus minus 40% on average that we had achieved. Other departments, of course, are having their own budget allocation, and it's far lesser than what health has got. I'll just give an example of Department of Sports. They would have a budget of about 200 million for preferential procurement, and they would have spent at least 40% or maybe 80% of their quarterly targets. But if you look into what health has spent on its quarterly target, it's way below what we had anticipated to spend, simply because the type of services we require are very technical in nature and not necessarily enabling our own black companies to come on board. I'll just give an example again of the type of service we need. We take note of the requests that have been coming through for maintenance or repair of medical equipment. Of course, there are these big firms that have, you know, the sole right and responsibility of manufacturing. And we must admit that as a country, we are still far-fetched from issues of manufacturing of these medical equipments. But what we have been trying to do is to then allow the small black firms to then partner or have an opportunity to maintain or repair these kind of machineries. Of course, the business is still monopolistic. We have these companies literally refusing to have small SMEs coming on board and maintaining their machineries. So it's still a long way of, you know, transforming the system. But I'm just trying to basically say we are aware of the current challenges that our own SMEs are facing, and we are trying as hard as we can to literally enable them to come into business. I think there was a question that was asked by members of the legislature a few weeks ago in saying, how then do we empower these SMEs to also form part of companies in terms of subcontracting on maintenance of these contracts? And we had then said, even though we would want to subcontract, there are very few companies that are skilled enough to maintain or repair or subcontract under these big companies. And when I speak of big companies, I'm basically referring to companies like Siemens. Those are companies that are literally have been in the market for years and have the know-how of manufacturing and maintaining their own machineries. And it's very rare that you'll find them giving access to small companies to then, you know, penetrate the market. But let me try and respond to some of the concerns that are raised and actually acknowledge the fact that we are very much aware of the challenges that the public is facing. Also in note of the percentage of unemployed youth that has now, you know, become so high in South Africa, specifically around Gauteng. Majority of our young people are qualified, but qualified not in the right type of skills. You know, you'll find graduates, majority of them being HR graduates, not to say HR is not, you know, a career that is needed, but very few are qualified as engineers. And we find it actually difficult to recruit and say, can we then capacitate you or make you partner with these big institutions for you to then get business opportunities in this regard. Just on the issue of the concerns raised by Naomi, I think they are from M company, and the fact that, you know, the company was liquidated. Honestly, it touched me in such a way that I became so emotional when I heard that the company has been liquidated only on the basis of us not being able to pay them on time, and, you know, issues of managing the business in terms of your cash flows, your bank balances and stuff. I know it's quite difficult, and talking from a a black female point of view, it is really not easy to manage finances and create jobs for those who do not necessarily have the jobs. But I don't want to make commitments, I don't want to make promises, but just to say, we take note of the things that you go through, and we want to empower black female-owned companies. And it is about us now ensuring that we open the scope or the space for you guys to then, be able to enter into this market space and the type of business that we need. There's quite a few, and I would say on female-owned companies, I think we were, of the 40%, we could only do about 25%. So it literally says our own female-owned companies are not necessarily exposed to business opportunities that are there in government. It's something that I'm noting, and I would want to encourage my seniors in saying, can we start as Department of Health? Okay, I worked for Department of Infrastructure for quite some time. And what we did was what we call a contractor incubator program. As you know, we are basically doing construction and, responsible for infrastructure and property management. So what we have done as DID at the time was to then select a number of youth and female-owned companies where we would then assist them receive funding from companies like Nedbank, and we give them business opportunities. We work with them through the engineering process and ensure that they comply in terms of tax, in terms of CIDB registration and the likes. It really helped, and that's something that I think with health we may, in fact not we may, we should start looking into and working on. There's a partnership that we have now made a recommendation to the HOD about, on provisioning of processed vegetables. I think of the tender that we have awarded recently, of all the regions, it was only one company in Tshwane that was female-owned that qualified for provisioning of these processed vegetables. Of course, the other 3 regions, we then decided to say, okay, in the absence of no company qualifying, can we then cancel? But in order for us to then bring in youth-owned and female-owned companies, so let me say black-owned companies, we then want to partner with Department of Agriculture, and I think it's an issue that we are starting now, where agriculture will then make provision for land and also resources so that you can do your own crops, and then we contract you to then, supply those kind of resources to hospitals and other health institutions. So I'm basically trying to say we are fully aware of the challenges that the country is facing in enabling or opening doors to business opportunities within government. And it's something that we're really working on. I honestly prefer or appreciate what Honorable Mabunda said in terms of ensuring that on township economy, we really review the bill or the laws that have been set, so that we create systems and processes in place that will actually fund our SMMEs and make also provision for support. Skills development, I can't wait to meet with you and really for us to debate and how then we can start empowering youth-owned and SMME companies, let me say, at local township levels. I think the COO has responded to majority of the issues that have been raised. The issue of funding is still a challenge countrywide. What I think our people lack is the ability to also manage their finances in terms of management. We have seen on several instances and several occasions where the first thing that we do when we receive $1 million in our bank account is to go and buy a car. You now want to move from the location to a suburb and change of lifestyle. Business requires knowledge and skills on how you can then diversify into other opportunities that are existing. It cannot be health equipment, health medicine only that would now give business opportunities. But you now also need to identify, or through our support, enable you to identify other opportunities within the system that will say, if you are a manufacturer of this machine, maybe then look into the probabilities of you also maintaining other machineries that are not necessarily what you are manufacturing. So it's part of diversification, part of learning how to manage your own finances as a business company. And of course, there's a need for us to empower as many South Africans as we can. We cannot choose whether you are black or white or Indian or colored. But the fact is, South Africans need business opportunities. And as government, yes, we will provide those business opportunities, but it will take time and it requires some kind of engagement and skills development. I'm just a bit concerned about speaker number 6, who spoke about, you know, the attitude of government employees when it comes to you know, servicing the public. Obviously, it's a culture that is really negatively affecting the system as a whole, and something that we are changing, trying to change on a regular basis by, you know, speaking to our people about the Batupele principles. How then do you treat a person on a normal call? If you can't help, please respond and say, I can't help you now. I'll refer you to somebody else who can help. I think it's not only an issue of attitude, but the manner in which business is conducted in general. We need to change that culture of treating people or doing business within government. And I take note of that, and it's something that we will definitely work on as a department. The issue of 30-day payment, honestly speaking, it requires not only a change in the system, but the mindset of our own people also needs to change. We cannot afford to overcommit and not necessarily manage cash and also manage our budget. So that three-way match of the budget, cash, and what we procure is something that we are trying as government to really ensure that we transform and we educate our people on. Don't commit when you are not sure as to when you will be able to pay. Don't commit, don't procure and receive assets when you know you will take time to pay. So that procure to pay kind of process is something that we are working on as a department, not only working on, but ensuring that our people also understand from a procurement point of view, from a budget point of view, and a financial accounting point of view. So it's a challenge. We are working on that. I think for the first quarter also as health, we were on average 48%, whereas other departments were already on 60, 70% and the likes. Reason for us not to have achieved even 50% of payment within 30 days, it's all because of invoices that we had accrued from the previous financial year into a new year. So the more we commit on procurement, the lesser opportunities we will then be able to have in terms of paying suppliers within 30 days. So the sooner we start controlling what we procure and how we then use this type of resources, the better it will be for us as a system. Funding issues in terms of sessions, it's quite a difficult issue. We've seen many companies being very dishonest in terms of, you know, agreements that are signed off. You receive money at the end of the day when you're supposed to be paying the borrower, you then run away. You know, it's something that we need to work on as a society, not necessarily as government only. But people need to also be taught on how to run businesses. We should learn as small businesses to actually honor our commitment, not to say majority don't, but there's a need for us to really understand what it means when you borrow money and cannot honor the commitment. I'm just making an example, colleagues. I'm sorry if I'm stepping on the toes of certain people or some of us, but in the true sense of the matter, there are just some things that we need to change as the public, as society, but also as government. I honestly appreciate the comments that have been raised, and we're looking forward to really improving the system moving forward. Thank you.
Thank you very much, CFO, sorry. Is there any of the CEO from our hospitals who would like to say something? Anybody, even if it's not a CEO, a representative from the hospital who would like to say something? Give her next to you. Thank you. It's from Tembisa Hospital, ne?
Yes.
You're welcome.
Thank you. Thank you, Chairperson, and good afternoon, colleagues and everyone who's around. I think this engagement was quite important and critical because it reminded me of a very usual cycle. That if we
create jobs, then we improve the township economy, and that will reduce poverty in our communities, and that will improve the health outcomes. So it's a vicious cycle. As much as health is separate from job creation or township economy, but it's one thing, it's a social determinant of health. If we improve the other, then we'll get better outcomes in health. So there's a comment that one of the stakeholders raised around hospitals, that things went bad when hospitals were now directly supplying equipment and other things. And I think as CEOs, I remember we had, in our hospital, we had a group of entrepreneurs that came with the same problem. They came to complain, to say, we are not getting any business from the hospital and what is happening. So we had to explain the process that we do from the hospital side. So majority of our supplies come from contracts. So whatever that is on contract, we don't buy it directly from the supplier. So everything that is on those RT contracts, hospitals don't supply directly. They get it from the contracts. It's only those things that are not on contracts that are buyouts, that we go to suppliers. And even in that situation, we use what we call the CSD, the Central Supplier Database, yes, the CSD. So with the Central Supplier Database, we realize that majority of our local entrepreneurs, they don't list the correct commodities. Because there's different commodities, they'll be listing construction. And there's other things. We provide medical supplies, surgical supplies, we provide food, we provide cleaning equipment, there's a lot of things. But if our entrepreneurs list the correct commodities, then we are able to identify them. And even on that system, we are able to actually choose that we want township or local suppliers. And then we select the suppliers. So if they're not listed on the CSD and they don't list the correct commodity, then they lose out. But also if we notice that they've listed this commodity and we are looking for it, we try to support them. We'll tell them that this specific equipment, whatever that we want, it's manufactured by these companies so that they go and source from those companies. So we try to support our local entrepreneurs by actually directing them to the correct entrepreneurs. Because the truth of the matter is, if we get wrong equipment, the environment that we're in, we cannot afford to be getting wrong things. So when we have a specification that we want this particular set for urology, if we don't get that exact set from urology, then we're gonna get bad outcomes. Now we end up with a long list of patients waiting for urology procedures because we procured a set from a local entrepreneur, but the set was not correct. And now it's a wasteful expenditure. The set is sitting there in theater and the list is long. These are the things that are happening in hospitals currently, where we actually procure from our local entrepreneur and it's not the actual thing that we wanted. And then it affects the outcomes at the end of the day. So we want the correct thing. And the other thing that we've noticed, like what the CFO mentioned, the big guys that produces the medical equipment, like RCA, Philips, Draeger, those are like the core. They manufacture most of these equipments. But then when we then get a local entrepreneur to supply, we direct them that this company will supply the equipment and they get it. The problem is when it comes to servicing and maintenance. It's gonna be back to square one. At the end of the day, we're gonna have a long waiting list for surgery because the equipment is not working and we can't maintain it or service it because that company, the original manufacturer is refusing to maintain if we didn't purchase it directly from them. So if it was through the local entrepreneur, then they refuse. We know recently I know Stolz got, they're now working with Tsenulo, the BEE. So Tsenulo is actually their formal distributor. So if we buy from Tsenulo that equipment, then Stolz will service the equipment, even though we bought it from Tsenulo. So there should be like an arrangement, an agreement between the local entrepreneur and those main manufacturers, so that when we buy the equipment from the local entrepreneurs, they'll still be serviced and they'll still be maintained. So I think those are like the issues. And from my side, I would really suggest or emphasize that we need to have strengthened program and training on all our local entrepreneurs on the CSD and ensuring that they do proper commodity listing and also directing them. And also an emphasis, I'm glad the CFO is here, and emphasize to hospitals that we should try to utilize our local suppliers and direct them. If they don't have that product and we know which company manufactures the product, we direct them to the actual company so that they do get business. Yeah, thank you.
Yes, I'm now getting responses from Department of Health. I think we have given the stakeholders an opportunity, but we are already planning another stakeholder this month. You will come and perhaps disagree with some of the responses. That is a promise to you. So, Dr. Matebula, do you have anything to say? Okay, it's fine, ma'am. I think Dr. Khongwane would like to say something.
Thank you, Chair. Is it on? Oh, okay. Thank you, Chair, and thank you very much for the engagement. I think we need to continue to have this difficult engagement. But what touched me is the issue of our stakeholders sending emails or calling and being intimidated in actually even complaining. I think we will have to speak with ourselves to say, how do we have a similar mechanism? Remember when people complain of care, that I was a nurse or a doctor treated them badly, there's a system. Maybe we should create a similar system where you, as a stakeholder, as an entrepreneur, can be able to complain, sort of a quality assurance kind of system, so that we can be able to redress those, because it's not nice to every time come to yourselves and you are told you have got a bad attitude. You know, it's very intimidating. But let the truth be told. I think it's fair that we hear that there's the image that you have of us to yourself as public servants, and you know, you hear that rahola, you know, and we don't care. That we need to really improve on that. But I think we need to have a system where if you send an email and nobody responds, then there should be a redress mechanism, because according to our table principle, we redress. We mainly redress on the basis of patients who complained, you know, and there's a robust system. Maybe we should establish a similar system. I think it will be discussed internally on how it can be done, so that when we meet, we don't have this, because this lady I could see the pain, and Mama, I could see the pain in you, I could feel it, and that's not nice. But it's good that we are here with yourselves to hear directly, you know, and we can only improve if we have these difficult conversations. When I worked at Dr. George Mukari, we used to have a quarterly meeting with all the SMMEs, where we gave info. I'm just sharing a story, it's an anecdote, it's a reality. Where we invited ABSA. ABSA at the time had a program where they were saying, we will fund you as an SMME, even if you're on the credit bureau. You know, it was a program that was introduced by our principals in head office, because there was a meeting held at where horses run somewhere, race course. Fontaine, yes, where the HOD introduced that program, and we took it up, and we had a quarterly meeting with all the SMMEs just to share information, just to say, like what the CFO has said. You find that you're not tax compliant. You find that whatever document is expired. You know, I remember one of the problems they had in the Harangua area was, I don't have money to go to Fox Street to put on the database. Then we had to ask Fox Street to come to Harangua. That was benchmark also on the DID when there was a problem with infrastructure issues, where then the DID came to Harangua and said, we'll help you to register properly and advise you. People are saying, I don't have money to photocopy, you know? So it was a way of being sincere in your empowerment of our people. But also there was this issue of where guys said, let nobody who's not in Harangua do business with Josh Mukari. And we had, by the time, MEC Mayatula Khoza, who said, I mean, you are actually shooting yourself in the foot. It means that you don't want to expand beyond Garankuwa. So I think that's one of the challenges we have, where as a hospital, you have the local entrepreneurs saying, please don't get anybody outside here to do business. It's impossible. But I think it's key to be truthful to say, as an entrepreneur, I don't think you want to end up here. You want to end up there. But let us engage in order to assist you to move, because knowledge is power, and knowledge is empowerment. And maybe the issues of WUMA licenses and so on. And probably sometimes what we need to do also is to give information from SARS to come over. Maybe we will come with that program, CEO, to help SARS come to talk, to talk to the entrepreneurs and give them information to say, this is how you apply for a tax certificate, you know? Because when I grew up, Chair, people said, no, you see, the richest people don't pay tax. The richest people put money under the mattress. And I still feel that there is that attitude out there. I would say, if you want to be rich, don't pay tax. And forgetting that the money that, the 3 billion that the CFOs talked about, it's a tax that is paid. It comes back. It's a revolving door that we need to establish. You pay VAT, it comes back to you as funding for Gauteng Health to help you as an entrepreneur. So we need to understand that revolving door. But each one teach one. I think let's continue to engage. And please don't like the chair said, you have those difficult things, right to the chair. If we need to be wrapped on the buttocks, let it happen in the interest of patient care in our communities. Thanks for the opportunity, Chair.
Thank you very much, Dr. Khongwane. Do we have any other hand from Department of Health? Dr. Majil.
Yeah, thank you, Chair, and entrepreneurs, my colleagues. I think this it's a welcome engagement. It's I think what should be made clear from our side is that no one is comfortable. Ourselves as hospitals, we aim for an inclusive economy. So when we procure services, we want to procure from our own black people. But yes, the barriers to entry have been mentioned. And I think we should continue to try and tackle those barriers. So for us, I think as hospitals, I always say to our staff at Calafon that people experience government through us, public servants. And when they come and say government is bad, they will have experienced it through how they experience Calafon, if they come to Calafon, whether as patients seeking healthcare or as business people, if they speak to a supply chain practitioner. So we've noted the feedback, and obviously we'll have to work on our attitude going forward. But then one other thing, with business people is that I hope we will get to some level where we can have a discussion. It's an emotive discussion, yes. We can have a discussion where we're not necessarily, because if we want to transform the economy and make things work better for everyone, we should remove ourselves from the situation. So if ever you approach and you say, I want to be part of the engagement, I want to be part of the discussions to improve our country, if we can remove yourself from the situation so that you're not necessarily looking for personal gain, because then it's not going to yield to this inclusivity that we are all yearning for. So that's and that's what I always say, even when we engage our local business people and say, you are here now, chances are if I show you what amount of business that we do with township business people, if your name is not there, you are still not going to be happy that your name doesn't feature. So, and it's what Dr. Kongwana has been referring to, that you will find that if I'm in Atteridgeville, the local business people will say, but I'm in Region 3. Actually, a person who is even in Salisbury, which is not Region 3, should not even be doing business with Kalafong, if I have to use that example. So these are the challenges that we have to grapple with. And I welcome this engagement, and I think the fact that we're still going to have continuous engagement, we have to start somewhere, and I think this is a good start, and ultimately we'll be able to have a much more inclusive economy where we can look at incubations, incubation programs for like especially in the maintenance of our equipment, where you can only go to 4 or 5 specific companies. And you will go to the CSD, source suppliers, you even create a PO for this supplier or service provider. After 4 or 5 months, you still haven't had the service provided. And you are under pressure because then patients are sitting, long waiting lists for operations, the quality of our services is compromised. So we have to look at things in that broader perspective if we really want to change. It's not only about looking at the budget that there's 5 billion that must be spent on the township economy. It should be, how do we do that without compromising the quality of the services? That is very important. So I will just pause here. Thank you.
Thank you very much for those inputs. I think we have come to the end of the responses by the Department of Health. We are moving towards the closure of our meeting. I think we are still on time. Yeah, we have learned that there are red tapes resulting from neoliberal or capitalist laws that are existing in our country, benefiting multinationals, disregarding local people. There is a need for workshop that will assist in improving the skills. Opportunity for skills transfer should be created. Funding issues are an issue for our township economy or entrepreneurs. There is a need for support regarding that kind of thing. Policy review to address imperatives or lawmaking is a need. Transparency is also important regarding procurement. Barriers exist all over. We are promising as a committee that we are going to organize a meeting, and we will invite economic development from our province. We will also invite Public Service Commission to be part of the meeting, because we have learned that some of our entrepreneurs are afraid to force the department, I'm not referring to Department of Health, some of the departments for payment. They're afraid that if they force or they push, they will not be given an opportunity in future, which should not happen like that. So we will also try to approach SAPRA. It's a national company. It's not at the level of the province, but we will try to request audience from them. We will also approach DTI in our next meeting so that some of the issues raised here are also going to be addressed. So at least we've identified those 4. I think Dr. Kongwana also mentioned the issue of the bank. We can attempt, but we don't promise anything there. But the government departments, we know those that are at the provincial level, we can, through the legislature, get access to those. So we thank you very much for, and we know that our stakeholder is tax compliant in many issues because they know their story. They are not beginners, but we wish can expand this work so that even the beginners come in so that they can also benefit from the health department's they should be beneficiary there because money is allocated for township entrepreneurs every year, and we don't know how much. Well, there are those perhaps who are benefiting, but it shouldn't be small number. But as our heading, our topic is showing, we are having a challenge because we don't see township entrepreneurs benefiting from Department of Health. As we are moving towards the closure, we don't want to say the status quo should remain. No, it shouldn't, so that our people benefits. We've got a lot of unemployment, and we cannot continuously have sole rights. We don't want to interfere with any company's rules, but we should have a way of working together as government. So let me take this opportunity to thank you very much, our stakeholder, for coming to this meeting and share your experiences in the Department of Health. We're promising you that the next meeting, we are also going to invite you. We hope the president will open and say maybe 100, then we can have a bigger number. But for now, 50. Us ourselves only as a committee, I think we are maybe 15. Already from 50, already 15 is taken by us. Department of Health, if there are 10 already, you know, more than 50% of that 50 is already taken up by the department. So we hope by the date that we have already agreed on, which we will not share now, we hope the president will have given extra numbers, because I think us as a province, we have seen that our COVID positive patients numbers have gone a little bit down. So we can do with 100 or so. So we really we're appreciating the interaction with yourselves. Our wish as a committee is to see that at least township entrepreneurs are beneficiaries. We are not saying they must go and start ordering an X-ray machine. No, that's not what we are here for. They know what they can supply, and they have been doing this work. So it can't be stopped because of certain red tapes. If it worked before, why has it stopped in the last 10 years? Let's encourage so that it continues. And you have seen that it was women who were in majority in terms of raising issues here. So we've got a program of Giodi. I think Serame knows Giodi, and the CEO knows Giodi. Everybody, they know Giodi. You have seen, out of 6 people who spoke here, 5 were women. So we need to improve that Giodi program through Department of Health. We're looking forward to interact with you again. Thank you very much, Department of Health. Thank you to the committee and the support staff. Kulekani et al. There at the back, we thank you for always supporting the work of the committee. We apologize for the mishap on the, it was for the first time we were attempting the hybrid, but it didn't work. But when we go to the next meeting, we do not want to sit in our houses and say we are afraid of COVID, because we have already received the jab. So we are ready to go out and interact with our communities. So this is part of what the legislature is expecting the committees to do. Public participation is important, and we will continue doing it. So as I've indicated already, the cooperative governance part of it will also be addressed in our next meeting. We appreciate you very much, and we thank you for coming and be part of our meeting. I think we will not labor too much on these issues. We already have got an idea as a committee, and I think the support staff will also provide you with something to eat before you go home. Thank you very much. Let's hand over all the gadgets that were given for interpretation to the relevant officer or official who is standing to you, and please ensure that you left your details somewhere there so that when we have the next meeting, we are able to invite you. And yeah, we need bigger audience going forward. Thank you very much. Thank you those honorable members who were connecting with us on the Teams, and all other members of public who were on YouTube and Facebook. We thank you very much. The meeting is adjourned.